co-sponsors, Councilmember Berliner, Reamer, Elrich, Florine, and also former Councilmember Branson, who's was co-sponsor of this bill. I also want to express my appreciation to the executive branch, Ms. Aluwalia, Mr. Dice, Ms. Kirkland, for working collaboratively on this legislation, as well as thanks to Leuna and the workers they represent at Potomac Disposal for bringing up this issue. This bill was introduced in February 4th of 2014. A public hearing was held February 25th last year as well. And we held work sessions on November 24th, 2014 and January 22nd, 2015. As it was said, the Joint Committee did vote 5-0 to enact the bill with amendments. As amended, the bill would, number one, require HHS to assist employees of county contractors and subcontractors in applying for insurance. Also require contractors and subcontractors to permit employees to meet with HHS on company time. Require contractors to report to DGS the number of employees who have health insurance. Require DGS to report to the council and executive on the number of county contractors and subcontractor employees without health insurance. And also there's a provision to sunset the law after 2 years so we can evaluate the impact of this bill, to get data that is needed, and to also evaluate the impact of the Affordable Care Act in terms of the success of this legislation. The amendment bill also strengthens the current living wage law by requiring DGS to retain quarterly payroll records for at least 3 years after the completion of the contract. This bill really is a very important first step in helping low-wage workers access health insurance. I think it also will help us by gathering the data necessary to understand the scope of the problem and possibly come back to make more significant modifications to the living wage law. And also want to thank our attorneys who did an amazing job helping us through all of this. And if there are any questions, they are here, Mr. Drummer and Mr. Hamlin, who have been very involved every step of the way. And this has been, I think, a labor of love, because the bill has taken, there's been a lot of iterations and a lot of just very active cooperation with the administration to get us to this particular point. So with that, I give you Bill 14-14.
Bill 1414 is adopted unanimously on a 9-0 vote. Next before